Hello everyone, welcome to Chapter 10, the Muscular System. The goal of this chapter is to get you familiarized with the main muscles that you have in your body. And the way we're going to do it is we're going to take a look at some pictures and concentrate on the actions of these muscles. Okay, so before we get started by taking a look at our muscles, I just want to make sure that everybody's on the same page. We're going to be treating this chapter very similar to how we treated chapter 8 when we were exploring all the different bones that we have in our body. So please make sure that before you continue on listening to the video, that you go onto D2L and you take a look in your exam number 2 folder and find the chapter 10, the muscle list for exam number 2 file. This is going to provide you with a Microsoft Word documentation that will allow you to see the table where I have all the muscles that we will be discussing fully labeled, as well as written down exactly where they are located in the body and their mechanism of action. I will be using that table as I guide you through the illustrations, but please keep in mind that when it's time to take our exam, that there are no images on the exam. Instead, I will be using the table and all the information listed on the muscle list document to draw my questions. So the questions will focus on the mechanism of action of the muscles, as well as where their general location is within the body. You will also notice that on the list, some of the muscles are grouped together. So for instance, you see that one is labeled as all the muscles that make up the hamstring muscles, all the muscles that make up the abdominal protection or the abdominal wall that's imperative to protect our cavities. So please have your chapter 10 muscle list with you, and go ahead and take your notations on that. And when it's time to study the exam, make sure that you know the muscles that are listed and their mechanism of actions. And as always, if you're not sure about something, please feel free to contact me and I'll be more than happy to elaborate and answer your questions. All right, so please make sure you have your muscle list. If you don't have it, just quickly go on to D2L. It's found in the Exam 2 folder. And whenever you have that Microsoft Word document, we are ready to proceed. You will also notice that there are a couple of slides that are going to follow this notation that will talk about some of the key terms that are used when describing the mechanism of the muscles. And this is all in an attempt to make sure that you actually understand or fully understand the full range that these muscles can have. All right, so let's proceed. Have some fun. All right, now first things first, when you discuss muscles, you're going to notice that they tend to pull, never push as their mechanism of action. And oftentimes you'll see that the muscle will be described as a prime mover or an agonist. This will be the main muscle that will be produced a specific movement that you're interested in doing. So for instance, when you're talking about doing your bicep curls or engaging your hamstring muscles, what is the exact muscle that is producing the mechanism that you're looking for? An antagonist will be a muscle that will oppose or reverse that particular movement. So for instance, if we do a bicep curl, what we're going to notice is that we're going to see the belly of our biceps contracting, but at the same time we're going to notice that our triceps, which are on the back of our arms, are going to be tensing up. So they're doing an antagonistic movement. It's an opposite movement from the initial muscle that you were looking at. You'll also see terms like synergist or fixator. A synergistic muscle is basically a muscle that's going to assist with the force. It usually has the same movement. It's going to allow you to accumulate a greater strength or a greater motion of action. So for instance, whenever you're lifting heavy items, you'll always hear the saying of lifting through your knees and not through your back. And the reason for that is because you have these large hamstring muscles in the back of your thighs that are fantastic at gathering all this power and allowing you to move the load that you're trying to do. But at the same time that you're engaging your hamstring muscles, you'll also be engaging your gluteus maximus, which is basically the butt. And those two muscles, the glutes and the hamstrings, are example of synergistic muscles. They tend to work together to increase the force. A fixator is usually a synergistic muscle that will immobilize the bone or the joint. So it will help kind of stabilize one part of the body to make it easier for another muscle to create its action of mechanism. So for instance, if we can go back to our biceps, if you're doing bicep curls, all the muscles that are associated with your shoulder joints, all those muscles are fixators because they're basically going to stabilize the shoulder joint so that you can move the arm up and down with your bicep curls without actually engaging any of the other muscles related in the thoracic or the shoulder joint region. On this illustration right here, it's going to introduce 4 terms that you're going to see quite a bit when you take a look at the action of the muscles in our muscle list. So those 4 terms are going to be flexion, extension, abduction, and adduction. Whenever you see that a muscle does a flexion, that means that's when it's engaged, it will cause movement towards the front of the joint. So for instance, you're swinging your hand towards the front of the body, that would be a flexion. If you swing your hands towards the back, then what you're doing is an extension, or you're moving towards the posterior end of the joint. Abduction with a B means that when you engage that muscle, it's going to cause you to have lateral movement, so away from the midline. So if you take your hands and you kind of extend it, stretching them out, spreading your wings, then what you're doing is you're doing an abduction. And if you now bring your hands back down to your midline, closer to your stomach, then what we're doing is we're doing a medial movement, returning it to the midline, so we're doing an adduction. So flexion towards the front, extension towards the back, abduction away from the body, and adduction towards the body, towards the medial side. All right, now overall there are about 600 muscles that we have in our body, and don't worry, we're not going to concentrate and be studying all 600 of them. We're just going to do the major ones that you'll get used to to give you a nice little base knowledge of your muscles, and from there on you can obviously build anytime you take a more advanced level anatomy and physiology class. Here's just a body-wide view of the different muscles. So I know some of you like to kind of piece the muscles together, whereas those of you want to kind of see how everything fits together nicely. So you can see it here from the anterior view. And here are the muscles from the posterior view. And the way I've organized our muscle list is that we're going to start off by the face, and then we're going to move our way downward, and we will be switching between anterior and posterior as we kind of get familiarized with the main muscles in our body. Alrighty, so this is our first illustration that we need to utilize. So why don't we go ahead and make sure that we have our chapter 10, the muscle list with us, so that we can kind of guide along as I'm chit-chatting to you. And if you have the list in front of you, and remember it's in your exam 3 module folder, you're going to go ahead and see that for my first muscle, it is labeled muscles of the face, and the first muscle I'm encountering is going to be called my frontalis muscle. So your frontalis muscle might sound very similar to the frontal bone because it is the same exact location. It is going to be a frontal belly muscle that covers the forehead and the dome of the skull. Here you have some other muscles that we're going to take a look at, and sometimes what you're going to notice is when you break down the name of the muscle, it will tell you exactly its location and its mechanism. So for instance, our second muscle on our list is called Orbicularis oculi. Orbicularis means to orbit, so you're looking for a muscle that's going to have a circular format, and oculi means the eye. So go ahead and find the Orbicularis oculi muscle on the picture. It is labeled on the right-hand side. You can see it is a circular muscle that goes around the eye. And I don't think it should surprise anybody that under its action of mechanism, I wrote down it closes your eyes, it produces blinking and squinting movement. You will also see one of my favorite muscles, which is called the zygomaticus muscle. And the zygomaticus muscle actually comes in a major and a minor. It's 2 of them, but usually they're so intertwined together that it makes it hard to distinguish. So for us, we're just going to go ahead and call it zygomaticus. The zygomaticus muscle is one of my favorite ones because it is your smiling muscle. When you engage the zygomaticus, it allows you to raise the side corners of your mouth, thereby generating a smile. The muscle that's labeled right below the zygomaticus is going to be called the rhizorius muscle. And if you take a look, you notice that it's coming off right from the corners of the lip. And that's because when you go ahead and cause it to contract, it will draw the lips laterally, causing them to tense. So that's kind of like the opposite of the zygomaticus. The zygomaticus is making us smile, and the rhizorius is kind of making us tense our lips. Here's another set of muscles where the name basically tells you everything that they do. So the first one is called the levator labii superioris. Levator means to levitate, means to lift. Labii is for the lips, and superioris is the top. So that means that this muscle, when it's contracted, will allow us to raise the upper lips. So it will allow us to open our lips by pulling against the upper lip. How about the depressor labii inferioris? Depressor means to pull down. Labii, once again, is the lips. Inferioris is the bottom. When this muscle is engaged, it will draw the lips downwards, almost in like a pouting mechanism. You're also able to see the orbicularis oris. The orbicularis oris, as you can see, once again, orbicularis means an orbital or a circular muscle. Oris is now going to concentrate towards the mouth. So what we're going to see is that it's a circular muscle that surrounds the mouth, and it's going to allow us to go ahead and close the lips, purse the lips, and whenever you are kissing or whistling, you are utilizing its contraction force. I also want to point out to you that a lot of our illustrations will show a superficial and a deep side. So for instance, when you're looking at the picture of the skull, you're going to notice that where the muscles are labeled on the left, that is the superficial side, meaning these are the muscles that lay directly under the skin. And then on the right-hand side, where you can actually see the bones, you're going to come across the deeper muscles, the muscles that are hidden underneath that first initial layer of muscle. Alright, so here is a little profile or lateral view, and let's make sure that we've taken a look at all of them. I think we skipped a few, so we want to make sure that we have everything. We saw the orbicularis oculi already. We saw the levator labii superioris. We have our smiling muscle with the zygomaticus. We haven't discussed the buccinator yet. The buccinator is actually going to be a deep muscle. It lies underneath the zygomaticus and the rhizorius, and whenever the buccinator is contracted, it basically compresses the cheek downwards. It is utilized for whistling or making suckling motions. Also, if anybody has ever taken a selfie and they've done the whole duck face, then that is your buccinator muscle that you're engaging when you're doing so. We have also discussed the depressor labii inferioris, the depressor anglii oris. I don't think I've mentioned that one, but it is on our list, so let's go ahead and find it. The depressor anglii oris, depressor once again means to move down. Anglii means it's at an angle or at a corner, and oris means it's by the mouth. So for our action, we have our depressor anglii oris will draw the corners of the mouth down and laterally, almost like you're making a grimace. An upside down smiley face, huh? We can also see from here that we have labeled our sternocleidomastoid and our platysma muscle. Our sternocleidomastoid muscle, it's this really large muscle that comes down from behind the ear and will make its way all the way down the neck. This muscle is often called your whiplash muscle because if you kind of strain your neck, which is usually seen in a car accident, you'll notice that you'll have a sharp pain when you turn your neck. That's the sternocleidomastoid muscle that tends to be injured. Covering the sternocleidomastoid muscle towards the front of the body is a huge sheet-like muscle that is going to be called the platysma. That is the one that kind of tenses the skin of the neck when you kind of try to suck in or pull down and stiffen your neck region. Here's a lateral view of the sternocleidomastoid, your little whiplash muscle, and the platysma. You can see how the sheet covers it completely from the front. We can also take a look at this cadaver picture where we could see the sternocleidomastoid. Once again, it starts towards the back by the temporal bone and comes down at an angle all the way towards the front, and you can see how your platysma is covering it. Notice also how the orbicularis oculi really looks like a circular muscle around that eye. Here are some facial expressions to kind of show you some of the muscles that we've just discussed in action. So go ahead and take a look at what's required anytime you are smiling or tensing your lips or you're pouting or you're doing your grimace. And I do hope that all of us use our zygomaticus muscle a lot today, which of course is our smiling muscle. All right, now let's go ahead and looking at my list, I see that after the muscles of the face, I have the chewing muscles that need to be discussed. And for the chewing muscles, we have the temporalis and the masseter. Now the temporalis is the muscle that's going to be associated with our temporal bone. And the masseter is going to be a huge chewing muscle that basically will wrap itself around the side of the mandible. And as you can see for its mechanisms of action, both of these muscles, the temporalis and the masseter, will allow you to chew, moving your mandible up and down. If you want to swing your mandible side to side, then you're going to need to use some deeper muscles, and those are going to be on the next slide. So here are our pterygoid muscles. They are lying underneath the temporalis and the masseter. They are also chewing muscles, but their mechanism will be to swing the mandible from left to right, so in a side-to-side motion. So temporalis and masseter go up and down, pterygoids go side to side. If it's now time to swallow the food, we see that we have three muscles that we have to discuss. You see two of them over here. Those are going to be your styloid and your thyroid. Your styloid is going to be interacting with your hyoid bone. Remember, the bone that doesn't make a connection point with any other bones in the body. The styloid is going to be lifting it up. And then your thyroid is going to be responsible for closing the glottis and allowing the food to lift and fall behind into your esophagus, away from the trachea. So in your mechanism of action on your sheet, it says thyroid is going to close the glottis so the food doesn't get into the trachea, and it's going to elevate the larynx, it's going to elevate your voice box, thereby the food will glide behind the trachea into the esophagus, which is where we want it to go on its way over to the stomach. In fact, to allow us to continue moving the food down the esophagus, we're going to take a look at our pharyngeal constrictors, which will be the third muscle we need to know in the swallowing section. Here are the constrictors labeled for you on the side, and what the constrictors will do is they'll basically push the food downwards so it glides through your esophagus. All right, so for swallowing, we have our styloid, we have our thyroid, and we have our pharyngeal constrictors. Let's take a look at breathing next. Our main muscle for breathing is going to be our diaphragm muscle. This muscle you've probably come into contact with before. It's a huge muscle that is shaped as a little dome. And it basically separates your thoracic and your abdominal region. And what we see happening is that your lungs will sit right on top of it. And when this muscle contracts, it actually lowers, it falls downwards. And as it falls downwards, it creates a larger cavity for the lungs. The lungs are able to expand, and that is then what we associate with an inhale. And when the muscle pops back into its original position, it squeezes the lungs, it makes it smaller, and that is now what we associate with an exhale. The lungs are not able to contract and relax by themselves. Instead, they rely on pressure points and muscle actions, and the main muscle that they will rely on will be your diaphragm muscle. Another muscle group that will be very important when it comes to breathing will be your intercostal muscles. Intercostal means that they're in between the ribs. So as you can see, they can come from two locations. Internal intercostals means that they start from the sternum and they radiate towards the back. External intercostals means that they start towards the vertebra and they radiate towards the front. I do want to emphasize the fact that your diaphragm and your intercostal muscles are just some of the primary muscles that will help you with breathing. There is an extensive list of other muscles that will contribute as well, especially if you are altering your breathing rate. So for instance, you're like hyperventilating, or you're holding your breath on purpose, or you're doing things like singing or screaming. There will be additional muscles that will obviously be recruited to assist with all this. So your diaphragm and your intercostal muscles are just two of the many that help with your respiratory system. Alrighty, so let's take a look at our abdomen. So our abdomen relies on four muscles that are going to kind of squeeze us in like a little girdle, and they're going to protect our organs that are located in this particular cavity. So we're thinking about our stomach and our small and our large intestines. So what we see happening is in the abdomen, you're going to have your external and internal oblique, as well as your transversus abdominis and your rectus abdominis. Please go ahead and take a look at your list, and you're going to notice that for the abdomen, I wrote down that your external oblique is going to be your superficial layer. So this is the outermost, the top muscle layer. And as you can see, it radiates from the side towards the midline of the body. Underneath the external oblique, you will have the internal oblique. If you look on the left-hand side of the illustration, you can see the internal oblique is underneath the external. Notice also how the striations, so the way the muscle fibers lie, have changed, making it easier for you to distinguish one muscle from the next. So internal oblique is the middle layer, and then the third layer is going to be called our transverse abdominis. The muscle fibers will run side to side in that case. So your external, internal oblique, and transverse abdominis, those three muscles are packed on top of each other. External from the outside, internal in the middle, transverse abdominis is going to be your deepest one. And then your rectus abdominis is going to be towards the midline of the body. This is the muscle that is separated in different segments due to little tendinous connective tissues, and these muscles will form your six packs. So all of us have a six pack because all of us have the rectus abdominis, and all of them have the little tendinous intersections that are separating them. It's just that some of us tend to hide our six pack underneath an adipose tissue layer, but we don't judge. But either way, when it comes to your abdomen, your girdle that's going to keep everything contained are going to be your external and internal obliques, your transverse abdominis, please know how they're stacked on top of each other, and your rectus abdominis in the center part, making up your six pack. In the back, we are going to have the trapezius and the latissimus dorsi on this illustration. Your trapezius is another huge muscle that's going to be extremely important to stabilize, elevate, retract, and rotate our scapula. And the latissimus dorsi is going to be a prime mover for our arm extension and will allow our arms to rotate at the shoulder. So there is your trapezius and your latissimus dorsi. Another muscle that is very important in the back is actually a collection of smaller muscles, but they're very long. And these muscles are going to be collectively called the erector spinae muscles. These muscles are going to run from the base of the skull all the way down to the sacrum. It's going to be a prime mover of back extension. So if you're sitting down, for instance, and you drop your pencil, as you're sitting, if you bend over to grab it, that is the erector spinae muscle that you're utilizing to bend your back to grab whatever fell onto the floor. Taking a look at our scapula, our shoulder, we're going to take a look at our pectoralis minor. Now, first things first, notice how the pectoralis minor is a deep muscle, meaning that it's located underneath the pectoralis major. And the pectoralis minor will help us protract and depress the scapula. It will also help us lift our ribs during forced expiration. So when you're forcefully exhaling, it will come in handy. We can also see our serratus anterior, which to me always looked kind of like a 5-finger muscle on the side. Some people like to describe it as flower petals on the side of the body. This muscle will abduct and rotate or depress the scapula. It is often also identified as a throwing muscle. Here on our little cadaver model, we can see our pectoralis minor, and you can see the serratus anterior. All right, back to our list we go, and we can see our next one is one that we've already seen before. It's the trapezius, and the trapezius is going to go ahead just to add a little bit to its mechanism of action, rotates the scapula upwards, retracts and depresses the scapula. And then our levator scapula, which is going to be on the right-hand side of our illustration, where the deep muscles are, it's all in the name what that muscle does. It levitates the scapula. It lifts up the scapula. And then you also see the rhomboids. The rhomboids muscles come in a minor and a major form. Collectively, the rhomboids will also elevate the scapula, so lift it up. As you can see, the trapezius muscle is the superficial muscle that covers up both the levator scapula and the rhomboid muscles underneath. Alrighty, so here towards the front, let's go ahead and take a look at the humerus. So what's happening by the arm region, and we see we have our pectoralis major. These are the pecs. This is where the breasts are located on top of it. The breast just means that you have an extra layer of adipose tissue that will sit onto the pectoralis major. The pectoralis major, I just wrote down for its mechanism of action that it's going to help you rotate your arms. You also have your deltoid muscle, which is the muscle that will cover over the shoulder. And if we switch over to the back side, we can see our teres major. The teres major is going to help us extend, rotate, and abduct our arms. So for the humerus, the top part of the arm, please know the pectoralis major, the deltoid, and the teres major. All right, so now we're going to flip over to our second page of notes. And what we see happening here is we can stay on this picture for a little bit because it's going to have us identify the muscles that are involved with the rotator cuff muscles. So the rotator cuff muscles are going to provide strength and stability anytime we have motion of the shoulder. And I would like you to know which muscles are involved with the rotator cuff muscles. They are going to be the supraspinatus, the infraspinatus, the teres minor, and the only one that's not shown on this picture, the subscapularis. So the supraspinatus, infraspinatus, teres minor, and subscapularis. Please know that those 4 muscles collectively make up your rotator cuff muscle, and they reinforce the joint capsule. Over here by the elbow, we can see our biceps, and we can also see our brachialis. Both of these are going to be our flexor muscles. On this illustration right here, we can also see that if we look towards the bottom part of our elbow, we're going to come across the brachioradialis, which is a really good example of a synergistic flexor because it's going to work together in conjunction with the brachialis and the biceps. And then towards the back of the arm, we're going to see the triceps, which is going to be a prime extensor. So it's going to work antagonistic to the biceps in the front. All right, so for the elbow, please know your biceps brachii, your brachialis, your brachioradialis, and your triceps brachii. Now, I want to point something out to you. As we're going to move down the arms, you're going to notice that we have a collection of muscles that will have the term supinator or pronator inside of its name. And whenever you see that, I want you to think of the fact that if the muscle has the supinator term within it, it's going to cause supination, which means that when it contracts, it's going to allow the palms to face anterior or towards the front. If you see that the muscle has the term pronator inside of it, it's going to cause pronation. Pronation means that it's going to allow the palms to face posterior, so towards the back of the body. So a supinator muscle causes your palms to face forward or anterior. A pronator muscle will cause your your palms to face posterior or towards the back of the body. The other thing that you can do, for instance, if you take a look at this illustration of the different muscles of the forearm and the wrist and the fingers, is go ahead and just look over some of the muscle names, and you're going to notice that a lot of them will have the term digitorum, carpi, or pollicis within it. Digitorum means that you have a muscle that will eventually insert within the digits or the fingers. Carpi means that you have a muscle that's going to insert within the carpal bone, so by the wrist. And the pollicis means that it's going to lead into the pollis, which is your thumb. So it's going to go ahead and reach and insert into the thumb section. In fact, if you look at the illustration all the way onto the right-hand side, you're going to see that in red, I've highlighted the tenor muscles of the thumb. This is a collection of muscles that make up the base of the thumb. All right, so here's just a look at some more muscles. Notice how we don't have to really identify specific ones. We just want to keep an eye on those key terms of digitorum, carpi, and pollicis, so that we can see if it's going towards the fingers, the wrist, the carpals, or the thumb. Alright, so let's take a look at the legs now, and we're going to start off with our buttocks region, the booty. Alright, so for the booty, we have three of them. We have the gluteus maximus, medius, and minimus. The gluteus maximus and medius are pictured on this illustration. As you can see, the gluteus maximus is the external booty mass, so that's the top one, the superficial one. Underneath it, you're going to have the gluteus medius. This one is going to help you shift your body weight anytime you're lifting your feet, and it also helps with rotation of the femur. Underneath the maximus and the medius, you will find the gluteus minimus. So let's switch over our illustration and let's find that deep muscle. Here you go. So here is the gluteus minimus. Notice how on the illustration they've indicated for you that they have to cut off the maximus and medius for you to see it. The gluteus minimus is not only the deepest muscle, it's also a very strong hip abductor. All right, moving on towards the front anterior part of the leg, this is towards the top thigh, what we're going to see is that we have our quadricep femoris muscles. These muscles are an extremely large muscle groups. They're going to be able to generate a lot of force that we use every day when we do things like jumping, climbing, running, rising from a seated position. They are a very powerful knee extensor, and I would love for you to be able to tell me which muscles fall in the quadricep femoris, and they are going to be the vastus intermedius, the rectus femoris, the vastus lateralis, and the vastus medialis. So for your upcoming exam, please make sure that you can tell me that the quadriceps femoris are one, located towards the front of the thigh. They are a powerful muscle group, and also that they are composed of the vastus intermedius, rectus femoris, vastus lateralis, and vastus medialis. And if we go now, still on the anterior part of the leg, but if we go down, we see that we're going to go ahead and come across the tibialis anterior, which will partially cover the tibia. Notice on the illustration how it doesn't cover the entire bone. You can see the tibia kind of sticking out. And this is one of the reasons I had mentioned to you in your bone chapter that if someone hits your tibia, your shin bone, it could be very painful because it doesn't have the cushioning of the muscle to absorb some of the shock. Either way, so the tibialis anterior, it's going to help us flex and invert the feet. Then we have our extensor hallucis longus. That one's going to allow us to extend the big toe and the ankle. And our extensor digitorum longus, that one's going to help us extend the toes and the ankle. Now, I will let you know that I was just basically trying to highlight for you that's very similar to the arm region and the hand. If you come across bones that are labeled digitorum, it means that it's going to eventually lead you over to your toes. And if you come across hallucis, it's going to lead you over to the big toe. So you don't be surprised if you come across a lot of different muscles within the lower part of the leg that have digitorum or hallucis in their name embedded. All right, so let's go ahead and flip over to the posterior side of the leg, and we're still at the bottom, and let's take a look at our calf muscle, which is called the gastrocnemius. The gastrocnemius is going to allow us to flex our knee and our ankle, and underneath the gastrocnemius, you're going to have the soleus muscle. The soleus muscle is a deep muscle, and it will assist with flexing of the ankle. All right, so we have our hamstring muscles left to go. So let's go ahead and switch over. Alrighty, so here are the hamstring muscles. The hamstring muscles are located on the posterior end of the thigh, and they are going to be your biceps femoris. And you can see you have a long head and a short head. You will have a semitendinosus and a semimembranosum. So very similar to what you did with your rotator cuff muscle and what you did with your quadricep femoris. Please be sure to be able to tell me which muscles make up the hamstring muscles. They're going to be the biceps femoris, long head and short head, the semitendinosus, and the semimembranosus. And obviously the location of the hamstring muscles will be that they'll be located on the posterior end of your thigh. So in the front of the thigh, the anterior, you have your quadriceps. In the back of the thigh, you have your hamstring muscles. As you can see, this chapter is a really nice and short one, so go ahead and take your time. Please make sure that you're studying right off your chapter 10 muscle list, because very similar to how we did the bones, I will be asking you questions based on those 2 pages of notes, as well as those first few PowerPoints of this presentation, where we were introducing our different key terms when it came to the movement of the muscle. As always, I am an email away, and also please keep utilizing the discussion sessions and be on the lookout for some pop quizzes coming up shortly.